another segment of Word of Mouth Wednesday. Today we're going to do something a little bit different. I'm pretty excited about it. We're going to be interviewing Dr. Russell Cecala. He's a periodontist in the northwest side of Chicago that our office uses very often, and we just love him. So before we begin the interview, I'd like to tell you a little bit about Dr. Cecala, and then we'll begin talking to him. And what we're going to talk about today is implants. So first, a little bit about Dr. Cecala. Dr. Russell Cecala is from the Chicago area. He attended Loyola University at Chicago, where he earned his bachelor's degree. Dr. Cecala then earned his dental degree from the University of Illinois College of Dentistry. Dr. Cecala's postgraduate education began with 1-year general dentistry residency in the U.S. Army at Reynolds Army Hospital, Fort Sill, Oklahoma. He served for 11 years in the U.S. Army, including active duty during the Operation Desert Storm. He was stationed in Vicenza, Italy for 3 years, where he attended to the dental needs of U.S. airmen, soldiers, and their families. Dr. Cecala returned to the States to continue his training at the University of Iowa, where he earned his master's degree in oral biology and his specialty certificate in periodontology. He is certified in several dental implant systems, and he presently lectures at the University of Illinois College of Dentistry and has held the title of Assistant Clinical Professor in the Department of Periodontics. Dr. Cecala is published in the professional journals and continues to lecture, and is a member of both the American Academy of Periodontics and the American Academy of Implant Dentistry. You can find Dr. Cecala in his office, Periocare, in the professional building at Rejection on the northwest side of Chicago, and you can also find out more information about Periocare and Dr. Cecala at the website periocare.com. So that's www.periocare.com. So right now I'd like to begin the interview with Dr. Cecala and welcome him. I'm so excited to have him here. So after that formal bio, I want to tell you that I've known Dr. Russell Cecala since 1986. We went to school together. And I've enjoyed working with him. He's a dear friend of mine, and I'm very excited that you're here with me today.
Oh,
so
thank you,
the
Claudia.
formal bio, but you're just very special to us at Family Dental Care Brothers.
As well as you are. Claudia's father was very special to me as well.
Thank you. Yeah, he was a good guy. So let's begin with the questions. The first question that I'd like to ask you is for you to tell us what an implant is, what it's made of, and what it is.
Sure. Basically, an implant is a titanium screw that's used to replace the root of a tooth that's missing, and it has to go into the bone, and it replaces from the root down, not the crown up. That's the dentist's part.
Right. And do some people have allergic reactions to titanium, or
it's an extremely rare occurrence that someone will be allergic to titanium. There have been some reported instances, but this is commercially pure titanium. It's the same materials that they use for artificial hips, for artificial knees. It is vastly used all over the world. The body really loves and accepts titanium, so that would be a very extremely rare incidence where there would be an allergy to it.
Okay, that's good to know. So tell us a little bit about what the day of surgery would be like. What can a patient expect when they walk in your door when they've decided to have a dental implant?
Sure. Well, we make all kinds of prerequisites according to what the patient's status is and the patient's health, depending on what it is. And some people require antibiotic treatment starting the day before the surgery. The patient will come in. They can either choose to be sedated or not. The majority of people go through this with a local anesthetic. It's really a very pain-free procedure. Patient is positioned in the chair. They're anesthetized with a local anesthetic, and depending on the case, sometimes a CT scan is used in order to find the proper locations and determine the proper locations of the implant placement relative to the other teeth and other vital structures of the anatomy. That would be used, and we would place a guide in the patient's mouth and double check to make sure that that's correct. And then again, based on the number of teeth, if they have to be removing a tooth, or if there's a tooth missing already, sometimes an incision isn't even required in order to place the implant in.
Okay.
So then the implant is, first thing is there's a little hole that's made, and we check the positioning of the screw with a little guide that goes in via an x-ray. Once we determine that it's in the proper position, the proper depth, Then we would widen that hole a little bit and to the appropriate size implant to fit the appropriate size tooth that we're going to replace. And then the implant is gently screwed into place, and then usually a little cover screw is placed over the top of that, and then the implant is allowed to rest, and either the incision is closed, or if there's no incision, the implant would be just left with a little cap on the top.
Okay. So it sounds like that there's no pain involved in this. I know that's a fear of a lot of patients when they come to a dentist or a periodontist, so it sounds pretty comfortable actually.
Yeah. It actually is one of the more comfortable procedures that we do. Like I said, sometimes really making the incision is the most amount of discomfort afterwards. During the procedure, there's absolutely should be no discomfort whatsoever. The patient usually completely numb, not feeling anything. You might experience a little vibration or the movement from the drill that's used. It's water cooled, and I have these patients come back and usually tell me, I give them pain medication oftentimes, and they'll come back and say, geez, I took the pain medication the first day because I was really nervous, and it turns out that I didn't have to take the pain medication at all.
I know that the patients that we send to you, we hear all the time about how surprised they are that there was absolutely no pain during, and actually, as you just said, post-operatively either. They don't feel like they have to take the pain medication, and they're pretty surprised because you think that if you're having something put into the bone that maybe that would be painful, but it's just not.
Right, it's not. It's actually it's the soft tissue around the bone that really causes the pain. So the gentler we can be to the gum tissue and placing the implant, the less discomfort the patient will have afterwards.
And another question that patients ask us a lot is there a chance of rejection? Different than allergy, is there a chance of rejection of a titanium implant?
No, there's really, patients don't reject the implant. What happens is they're based on, again, the patient's medical history and the patient's profile. There are certain times when the patient would be at high risk for the implant to be either become infected or the bone not heal properly around the implant. And those situations would be certain patients with, say, a diabetic patient or patients that smoke. Combinations of all these different things, severities of periodontal disease may put you at a greater risk for the implant not to integrate properly into the bone, but it's not a rejection factor. It has something to do with the patient's profile.
Got it. Okay, that's important for them to know. Can you tell us a little bit about bone grafting? Now, sometimes patients need to have additional bone in order to support the implant. Can you tell us about what bone grafting is?
Sure. That's a very, very good point, because the most important part about the implant procedure is really the diagnostic workup to place the implant.
Ahead of time.
Yes. So when the patient comes in, usually it's an hour and a half consultation to review their medical history and to find out where the implants need to go. And then we have to decipher, is there enough bone to put the implants into place? Not only that, we like to know what the quality of the bone is as well. The upper jaw is different than the lower jaw as far as the densities of bone. So in some cases where the bone is too thin, we can use a graft material, which is actually cadaver bone, to widen the area where the implant needs to be positioned, so that there's enough bone that completely encompasses the implant 360 degrees.
Okay, all right. And how quickly can people expect to have their restoration place? That's a big question for people.
This is a very big question that we get all the time. In the era of tooth in a day, we have lots of patients that come in and say, oh, I heard about tooth in a day. So basically, again, we have to go to the patient profile, and each situation will dictate how long it will take before the patient finally receives the final crown that goes on top of the implant.
Right.
So in some cases where there's good healthy bone and enough of the bone, we can place the implant on that day and put a screw on the top of the implant called an abutment, and I'll show you what that is here.
I was going to ask you to show us some of your toys here.
This is the abutment,
okay,
and that screws into the top of the implant.
Okay.
And that is what the dentist then builds the crown of the implant on, and that goes on here.
Right.
Well, if the implant the bone is strong enough, and we can put the implant in, tighten it down to a certain force, we can put that little temporary screw on and put a temporary crown on the implant on that day.
Okay.
However, we have to make sure that it's not in use, so really it's for aesthetic purposes only.
Right.
Okay?
You don't want to put any pressure on a newly placed implant.
Exactly, exactly. So you're back to the question of how long does it take before you get your tooth? Well, that's a very, very broad question. So if you come in and we have to remove a tooth and there's not enough bone to place the implant, we have to put the bone in and allow that to heal. That sometimes can take anywhere from 4 to 6 months.
Okay.
Then once the implant is positioned, again, determined by the strength of the bone, again, there's another waiting period for the implant, for the bone to heal around the implant, and that could take anywhere from 4 to 6 months as well.
Okay.
Now, there's always an exception where in some cases we do place multiple implants and we can position the restoration on the same day. Those are very, very few cases.
Very specific.
Very specific cases, very narrow criteria that the patient has to fit in order to do those types of things. So I would say on average, from the time the implant is placed to the time that you would get your new tooth to replace the missing tooth would be approximately 6 months.
Okay. All right. Well, show us, this is kind of an interesting model. Show us so that people can appreciate the greatness of a single tooth implant, what would be the alternative if you didn't have an implant, what you could do if you had a missing tooth.
Absolutely, absolutely. So the patient is missing a tooth, and we'll just take this little thing out here, and we'll just pretend that there's no implant in there, okay? And we have to offer the patient different options to how to replace the tooth. So one option used to be conventional therapy in dentistry to replace a missing tooth would be to grind down the two teeth on either side of where the missing tooth was. So that's what they would do. This is how it would look. And then they would take a mold and they would build a bridge that goes from one tooth to the other to replace the tooth. It's really not replacing the tooth, it's just putting a bridge between the two teeth on either side. The drawback for this is that the dentist has to really destroy the two native teeth on either side.
And they may have been very healthy teeth.
And they could have been very healthy teeth. So anything that you do to a tooth damages the tooth. So the less we do to a tooth is the better for the tooth.
Got it.
So in that case, we offer the two different options and let the patient make the decision as to what fits their preference.
And with all that information, they can make an intelligent decision then based on
Absolutely. And again, in the consultation, if anybody's receiving a consultation, they should leave with all of their questions answered. Don't be shy about asking questions. These are all very good questions that a patient should be asking during consultation if they're not covered by the person that's going to place the implant or restore the implant.
And the last question that I get all the time is does an implant last forever?
Implants will last forever if they are properly cared for, if the patient is again of a certain criteria, certain specific, without any drastic medical concerns, if they are non-smokers. Well, when we say will it last forever, the studies have shown us that placement of an implant without any medical history and in non-smokers, that there's a 95 to 97% success rate, meaning that the implant screw will be remaining in the bone for 20 years and longer. So that doesn't mean at 20 years that it's going to fall out. That means that that's how far the studies look, and so the implants are in there much longer than 20 years oftentimes. If there's a problem with the implant where it's just like a tooth except for it can't get decayed. So a dental implant can have periodontal disease, we would call it peri-implantitis, around the implant, and that has to be treated by the person that put the implant in. It's critical that when a person has an implant placed, that they go for routine cleanings between their dentist and oftentimes the surgeon would like to see them at least maybe once a year to take x-rays or to check around the implant to make sure that everything is okay. An ounce of prevention is worth a pound of cure. So They do last a very long time. I won't say forever.
Okay, all right. Well, you've answered a lot of questions that our patients ask all the time when they come, and I try to work with them, and our dentists try to work with them and answer to the best of our ability. But it really is nice to have Dr. Cecala here because he is the one that does this, and he has answered these questions great. So I really appreciate your time today.
Thank you very much for having me. I really
I've had a
appreciate
really
it.
good time, and that's it. So that was great fun. I enjoyed interviewing Dr. Russell Cecala today. He shared with us his time and his expertise on dental implants, and for that I'm very grateful. If you have any questions about dental implants, any questions that we didn't cover here today, please feel free to give our office a call. We'd be happy to help you. Or email us at info@parkridgedds.com. info@parkridgedds.com, and we'd be happy to answer your questions. So thank you for joining us today. It was a fun adventure. And I want you to remember, as always, we love making you smile.